To study pharmacokinetics, plasma concentration time curves are used. The therapeutic effect of a drug is dependent on its concentration at the site of action. For example, in order to treat an infection in the brain, the antibiotic must be able to reach the brain with a suitable concentration. However, it may not be practical to measure the concentration of the drug at the site of action. For example, you can't measure the amount of drug in the brain. An alternative would be to measure the concentration of the drug in the blood. The concentration of drug in the blood is in equilibrium with the concentration of drug at the site of action. Therefore, we can take the drug concentration in blood plasma as an index of the concentration of drug at the site of action. It also reflects the clinical effects of the drug. This graph shows the plasma drug concentration time curves for a few different formulations of a drug. To collect the data, the drug must first be administered to healthy volunteers, and then their blood is taken to measure the drug concentration at different time points. You can see that for the IV drug, which is represented by this blue line, absorption is immediate, so the concentration is highest at the beginning. It is eliminated by the body, so the concentration will drop over time. Then, comparing the oral solution, oral tablet, and the oral slow-release tablets, you can see that the oral solution, the green one, is the fastest to be absorbed, followed by the oral tablet, which is the red line, and then the oral slow-release tablet, which is this yellow line. Let's take a look at the plasma drug concentration time curve following a single dose of the drug. As the drug gets absorbed, the plasma drug concentration rises. There is metabolism and excretion taking place as well, but initially, the rate of absorption is higher than the rate of elimination. Eventually, absorption slows down and elimination increases as well. So, the plasma drug concentration starts to drop until it reaches zero or almost zero. The highest concentration is known as the peak concentration or Cmax. In this example, you can read from the graph that the Cmax is about 10 micrograms per ml. The time taken to reach Cmax is known as Tmax. In this example, you can read from the graph that the Tmax is about 5 hours. The area below the graph is known as the AUC or area under the curve. On the graph, you can also see that the minimum effective concentration is 6 micrograms per ml. Below this concentration, the drug has no effect. The toxic concentration is 12 micrograms per ml. If the peak level of the drug exceeds this value, the patient will experience toxicity. Therefore, the aim is for the blood levels of the drug to fall within the therapeutic range so that there is enough drug to be effective, but not too much so that it becomes toxic. Now let's take a look at the red line, which is the plasma drug concentration time curve. As the drug gets absorbed, the concentration increases. Once the concentration reaches the minimum effective concentration, the drug will start to take effect. This is known as the onset of action. In this example, you can see that the onset of action occurs at 2 hours. The plasma drug concentration remains above the minimum effective concentration until 8 hours. This is the duration of action. Since the drug is effective from hours 2 to 8, the duration of action is 6 hours. If a patient takes multiple doses of a drug, the plasma drug concentration will initially increase with each dose until it reaches a steady state. This steady state should fall within the therapeutic range so that the drug will exert its therapeutic effect but not produce toxic effects.